Hello, welcome to another episode of Arthritis and You, A Joint Journey. Today, we've got something special lined up, so buckle up because it's time for the deep dive. Let's give a warm welcome to our hosts, Arthur and Sarah.
Welcome to the deep dive, where we dive deep into your health questions. And today, we're tackling rheumatoid arthritis. You've given us some material from Alberta Rheumatology, so it's clear you're ready to go beyond the basics, which is perfect because, well, that's what we do here.
Exactly. We're talking causes, symptoms, treatments. We're going to break it all down in a way that's easy to understand, whether you're newly diagnosed, supporting someone with RA, or just, super curious about how it all works.
Love it. Let's jump right in. First things first, what is rheumatoid arthritis?
So the Alberta Rheumatology FAQ puts it really well. It's an autoimmune disease. Basically, your immune system, which is usually the good guy, right, is supposed to be fighting off infections and stuff.
Right.
Well, in RA, it kind of gets its wires crossed. It starts attacking the lining of your joints, like mistaking it for something dangerous.
So it's like your body is at war with itself. That's got to be rough. And it's not exactly rare, is it?
Unfortunately, no. The FAQ says about 1 in 100 people have RA.
Wow, that's way more common than I realize.
Yeah, it really highlights how important it is to understand this condition. And, one thing that often trips people up is the difference between RA and osteoarthritis.
Oh, yeah, I can see how those get mixed up. They both involve achy joints, right?
They do, but the underlying cause is totally different. Osteoarthritis, it's like wear and tear, like your favorite pair of shoes getting worn down over time. It's the cartilage in the joints breaking down.
Makes sense.
RA, on the other hand, that's your immune system attacking those joints like they're a threat.
Okay, so it's not just everyday wear and tear. It's this whole internal battle going on.
Right.
But, what triggers that battle in the first place? Why does the immune system go rogue like that?
That is the million-dollar question, honestly. Researchers are still trying to pinpoint that exact trigger. It's like searching for a needle in a haystack.
Frustrating. So it's a mystery, but they must have some clues, right? Like, what makes someone more likely to get RA?
You're right. It's not a complete mystery. Genetics definitely play a role, so family history is a big one. If you've got close relatives with RA, your chances of developing it are higher.
That makes sense.
And here's a big one, and it's something that people can actually control: smoking.
Oh, wow, really?
Yeah. Smoking significantly increases your risk of developing RA, and it can actually make the disease more aggressive.
So even if you have a family history, quitting smoking can make a real difference.
Huge difference. It's like hitting the brakes on a runaway train. It won't erase your risk entirely, but it can significantly slow down the progression of the disease and make managing the symptoms way easier.
That's amazing. Okay, so we know it's the immune system going haywire, but for someone with RA, how does that actually feel? What are they experiencing?
Well, joint pain is the hallmark symptom, but it's often described as more than just "I work out too hard" kind of pain. It's deeper, more intense, and according to the Alberta Rheumatology materials, it often comes with stiffness, especially first thing in the morning.
Yeah, I've heard about that morning stiffness. It's like your body hit the snooze button on the day before you even got out of bed.
Exactly. And you can make those everyday tasks, buttoning your shirt, opening a jar, they become almost impossible.
Wow, so it's more than just the pain. It really impacts your ability to function.
Exactly. And here's the thing. RA doesn't just affect your joints.
Really?
Yeah, it's a systemic disease, which means it can impact the whole body. Fatigue, for example, is a huge symptom that often takes people by surprise.
It's like your body is waging this whole internal war, and it's exhausting.
Exactly. And because it's systemic, RA can also affect other organs. The FAQ mentions potential impacts on the skin, eyes, even the heart and lungs, though that's usually in more severe cases.
Wow. Okay, so definitely not just achy joints. So let's say someone is experiencing these symptoms and goes to the doctor. How is RA actually diagnosed?
Well, unfortunately, there's no single test that says, yep, you've got RA. If only it were that easy, right?
Right, so no instant answers. How do they figure it out then?
It's a bit of a process, honestly. Your rheumatologist, they're going to start by really digging into your medical history, asking about your symptoms, of course, but also things like, is there any family history of RA? What about your lifestyle? Things like that.
Okay, so gathering clues like a medical detective.
Exactly. And then they'll do a physical exam, checking for tenderness, swelling, how well your joints move, that kind of thing.
Makes sense. So it's pretty hands-on. What about blood tests? I feel like those are always part of the equation.
You're right. Blood work is definitely part of it. They can look for inflammation markers and certain antibodies that are often associated with RA. But here's the thing.
Yeah.
A blood test alone can't diagnose RA. It's just one piece of the puzzle.
Gotcha. So it's really about putting all those pieces together. What about x-rays? Don't they usually x-ray joints when there's a problem?
They do. But for an initial RA diagnosis, x-rays aren't always necessary, especially early on, because the damage might not be visible yet. They're more helpful for keeping an eye on things over time, seeing if there's any progression.
Ah, so it's more like getting a baseline.
Yeah, exactly.
Makes sense. Now, once you do have that diagnosis, I imagine treatment is top of mind.
Absolutely. And the good news is, treatment for RA has come a long way. There's a lot more hope now than there used to be. More options for people.
That's great to hear. But looking at this treatment page from Alberta Rheumatology, it doesn't look like there's a one-size-fits-all approach.
You're right, there isn't. The page talks about different categories of medications, and finding the right combination for each person, that's a process. Your rheumatologist, they're considering how active your RA is, your overall health, even your lifestyle. All those factors come into play.
So it's really tailored to each individual.
Exactly.
Let's break down these treatments a bit. Starting with, I think everyone's heard of these, NSAIDs. What are they exactly?
NSAIDs, that stands for non-steroidal anti-inflammatory drugs. Basically, think over-the-counter pain relievers like your ibuprofen, naproxen, that sort of thing.
Okay, so the stuff you reach for when you have a headache or a sore muscle.
Exactly.
But those don't cure RA, do they?
They don't, unfortunately. They can help you feel better, though, because they reduce inflammation and pain, which can be a huge relief for people.
Right.
But they're not addressing the root cause of the problem. You know, it's kind of like putting a Band-Aid on a bigger wound.
So, helpful for symptoms, but not a long-term solution. This page also mentions some risks with NSAIDs, though. That's a bit concerning. Should people be worried about taking, like, an Advil for a headache?
It's always smart to be aware of the risks with any medication. In this case, the page specifically says that if you have high blood pressure, kidney problems, liver problems, things like that, you got to be careful with NSAIDs.
Okay, so not something to just take without thinking about it. Definitely talk to your doctor, especially if you have other health conditions.
Absolutely, yeah.
Okay, so if NSAIDs are the Band-Aid solution, what about those disease-modifying drugs, the DMARDs? Those sound more intense.
They are. DMARDs, those are like the heavy hitters when it comes to RA treatment. They actually work to slow down or even stop the progression of the disease. Not just masking the symptoms like NSAIDs, but going after the underlying issue, you know?
So getting to the root of the problem.
Exactly.
But the page mentions side effects with those too, right?
You're right. There are potential side effects, and they can vary depending on the specific drug.
Yeah.
But that's where that open communication with your rheumatologist is so important.
Right.
They'll go over everything with you, explain the risks and benefits, so you can make an informed decision together.
Okay, that makes sense. You're not just in the dark. You're making those decisions as a team.
Exactly. A team effort.
Now, this page also mentions something called biologic DMARDs. Those sound, I don't know, kind of futuristic.
They kind of are. They've been a real game changer for a lot of people with RA. So traditional DMARDs, they're small molecules. But these biologics, these are genetically engineered proteins. They're designed to go after very specific parts of the immune system that are involved in RA inflammation.
Oh, wow. So it's like they have a target. They're not just hitting everything.
Exactly.
Yeah.
And because they're so targeted, they can be incredibly effective at reducing pain, inflammation, even slowing down joint damage.
That's amazing. I'm guessing, though, that they probably don't come cheap.
You're right, they are expensive. They're the most expensive class of DMARDs, unfortunately.
Right.
But the good news is, a lot of insurance plans do cover them, and there are often programs to help make them more affordable for patients who need them.
Okay, that's good to know. So definitely worth looking into. We've talked about NSAIDs, DMARDs, these biologic DMARDs. What about steroids? I feel like those are always controversial.
Yeah, steroids can be a bit of a double-edged sword, you could say.
Right.
They work really well. They're powerful anti-inflammatories, so they can provide really quick relief from RA symptoms.
So they work fast.
Yeah, people often see a big difference in their symptoms really soon after they start taking them.
Okay. But there's a downside.
There can be. It's all about the long-term use. Taking steroids orally for a long time, that can lead to a lot of side effects. You know, it's like using a jackhammer to fix a leaky faucet. You might fix the faucet, but you might cause other problems in the process.
I like that analogy. So short-term use is the key.
Pretty much, yeah. Steroids, they're a tool, but they're a tool that needs to be used carefully.
Makes sense. So we've talked about a lot of medications here, but what about lifestyle changes? Is there anything people can do on their own to help manage their RA?
Absolutely. The Alberta Rheumatology site really stresses that. Lifestyle changes, those are key. It's not just about the meds. It's about taking a holistic approach to managing your RA.
So it's about empowering yourself, too.
Exactly. And those lifestyle changes, they can make a real difference.
Like what? Give us some examples.
Exercise, for one.
Really? Exercise. But what about when your joints hurt?
I know, it seems counterintuitive, right? But honestly, it's so important. The website actually says that keeping your joints moving, maintaining that mobility and strength, that can actually help protect your joints over time.
Wow. So it's not about pushing through pain, though.
No, definitely not.
Yeah.
We're talking gentle exercise, things like swimming, walking, tai chi, that kind of thing. And strength training is important too. Stronger muscles, they actually help support your joints better, which is crucial when you've got RA.
Right. So you're giving your joints some extra support. But everyone's different, especially with RA. Should people talk to a professional before they start any kind of new exercise program?
Oh, for sure. Definitely check with your doctor or a physical therapist, someone who can assess your specific situation and help you come up with a plan that's safe and effective.
Okay, that makes sense. So exercise, check. What about diet?
Yeah.
Any magic foods for RA?
No magic bullets, unfortunately. But like with exercise, healthy diet can make a big difference. The Alberta Rheumatology site really emphasizes staying at a healthy weight.
Makes sense. Less weight, less stress on your joints.
Exactly. And of course, eating a balanced diet, lots of fruits and vegetables, whole grains, lean protein, all that good stuff, that's important for overall health, including joint health.
Right. Those are good guidelines for everyone, really. But anything specific to RA when it comes to diet?
Well, remember how we talked about smoking being a big risk factor for developing RA?
Yeah.
Well, it gets worse. Smoking can actually make RA harder to treat, and people who smoke tend to have a worse prognosis overall.
Oh, wow. So quitting smoking isn't just about prevention. It's also about managing the disease more effectively if you do have it.
Exactly.
Okay, message received. Put those cigarettes down, folks. Your joints will thank you. Now, this website also mentions omega-3 fatty acids, like the stuff in fish oil. They say that might be helpful for RA. What's the deal with that?
Yeah, omega-3s, they have shown some promise. Some studies suggest they might help reduce joint pain and stiffness.
Okay, so not a cure-all, but potentially helpful.
Exactly. It's thought that their anti-inflammatory properties might be what helps. But again, like with any supplement, it's a good idea to talk to your doctor before you start taking anything new.
Always good advice. Now, we've covered a lot here: causes, symptoms, treatments. But I want to circle back to something you mentioned earlier about talking to your rheumatologist. Why is that open communication so important?
It's so important to be an active participant in your own health care. RA is different for everyone, so cookie-cutter treatment plans, they just don't cut it.
So you really need to be in the driver's seat working with your rheumatologist to fine-tune things.
Exactly. Don't be afraid to speak up, ask questions, really advocate for yourself. What's working? What's not working? Any concerns you have. Your doctor needs to know that stuff to give you the best possible care.
You're your own best advocate, that's for sure. Speaking of advocating, the Alberta Rheumatology site mentions this rheumatoid arthritis education program in Edmonton. What's that all about?
Oh, it's a fantastic resource. They offer education about RA, obviously, but also treatment options, coping strategies. They even have workshops to help people deal with the emotional side of things. Because, let's face it, chronic illness is tough.
So it's like a support system built right in.
Exactly. And that's something I really want to emphasize. You are not alone in this. There are resources out there, people who understand, and a whole community ready to support you.
That's so important to remember. We've covered a lot of ground on this deep dive into RA, but I do want to touch on one more thing that caught my eye in these materials, this idea of participating in research studies. It's easy to think of research as something that happens in a lab somewhere, but you're saying it's not like that.
Not at all. Research is happening right here in Alberta, and it's getting more collaborative all the time. Scientists are working directly with patients, healthcare providers, making sure the research questions are actually relevant to people living with RA.
So it's not just theoretical, it's about solving real-world problems.
Exactly. And that's why these research study opportunities they mentioned on the website, they're so important. They're a way for people with RA to contribute to advancements, maybe even benefit from new treatments down the line.
Okay, I get that research is important, but I think some people might be hesitant to participate. They might picture, like, needles and scary experiments. What would you say to someone who's on the fence about it?
I totally get it. Those concerns are valid. But first of all, participating in a study is always a choice. You're never obligated, and you can back out at any time. But honestly, a lot of those scary ideas people have about research, they're just not accurate. There are strict ethical guidelines in place to protect participants.
So it's not like you're a guinea pig or anything.
Exactly. Plus, you go through something called informed consent before you even sign up for a study.
Yeah.
So you're getting all the information up front, what the study's about, what's involved, potential risks and benefits, all of it.
So you're making an informed decision, not just blindly agreeing to something.
Exactly. And you can ask all the questions you want, talk about your concerns with the research team. They're there to support you.
Okay, that makes sense. Now, for someone listening who's thinking, hey, I want to get involved, where do they even start? How do you find out about these research studies?
Well, the Alberta Rheumatology website, that's actually a good starting point.
Yeah.
They often have info about current studies, who's eligible, how to contact them, that kind of thing. You can also talk to your rheumatologist. They're usually in the loop about what's going on.
Right, you use those resources you have. It's kind of amazing. Just by participating in research, people with RA can really be part of shaping the future of how this disease is treated.
Absolutely. It's about empowerment. It's about collaboration. It's about, continuing to search for better treatments and hopefully someday a cure.
Now that is a message of hope. Well, folks, there you have it. We've done our deep dive into rheumatoid arthritis. It's a complex condition, but there's so much you can do to manage it and live well.
Knowledge is power. And remember, you are your own best advocate.
We hope you found this deep dive helpful, empowering even. Stay curious, stay informed, and we'll see you on the next deep dive.
This has been another episode of Arthritis and You, A Joint Journey, brought to you by the Rheum team from albertarheumatology.com, your trusted evidence-based suite of resources available 24/7. Straight from Alberta, but for folks around the world. Our hosts today, Arthritis and Sarah Upis, technical producer, John Ifund, and our executive producer, Stephen Cates. While we work hard to maintain the accuracy of our information, we accept no legal responsibility for any errors or omissions. Remember, always check with your own physician first. Join us next time for another Deep Dive.